Hello, my name is Sylvia Brown, and I am the community educator here at the Pittsburgh Poison Center. Today, I am going to be talking with Dr. Edward Krenzelok, who is a former director of the Pittsburgh Poison Center and the Drug Information Center at the University of Pittsburgh Medical Center. How are you today, Dr. Krenzelok?
I'm very well, thank you, and it's great to celebrate 50 years of the Pittsburgh Poison Center and Mr. Yuk.
So what do you remember about the early years of Mr. Yuk?
Back in the beginning, people were enthralled by the Mr. Yuk jingle, and hopefully you found a copy of that. You know, Mr. Yuk is mean, Mr. Yuk is green, home is full of lots of things children should not touch, and so on. But that was a very catchy jingle that attracted people. And I remember when I lived when I was director of the Poison Center in Minnesota, woke up in the middle of the night one time, my television was on, and I heard, "Mwah," and it was the Mr. Yuk jingle at 3 in the morning, prime time.
So how did the focus move towards poison prevention education?
The Institute of Education Communications was developed, and that was sort of an offshoot of the Poison Center, but under a separate budget center at Children's Hospital. And they, under the leadership of Dick Garber, developed lots of the poison education materials that we used in Pittsburgh and that were used across the country and throughout the world, for that matter. And that was a very important group because it took a lot of burden away from us from an education standpoint. And we didn't have an educator like you at that point in time. So my education was, yes, I went out and did lots of talks. I went to schools, I went to hospitals, I went everywhere and did tons and tons of media to promote the Poison Center and so on.
Well, since we are celebrating 50 years of Mr. Yuk, let's talk a little bit about Mr. Yuk. So how exactly did the Pittsburgh Poison Center utilize Mr. Yuk as an educational tool?
Well, we used it, again, materials. All our member hospitals every year would receive free 1,000 sheets of Yuk stickers and hundreds of brochures, and we sent out mass mailings to all of our member hospitals free of charge, and they were largely responsible for distributing materials in their emergency departments and pediatric clinics and so on. Then we would send out mailings to schools. We got very involved with Giant Eagle and Giant Eagle pharmacies, and they served as a major distribution site for materials. So we didn't do a lot of the hands-on things that you're doing, Sylvia, where you're out, teaching poison prevention. Yes, we did some, but we were limited. I couldn't afford to have my staff out in schools when indeed they needed to be answering the phones. And so a lot of that fell on me, but I only had so much time to do that as well. But in Pittsburgh, we used Yuk, and we let a lot of other people do our education for us directly. And then what I saw happen over time, Sylvia, was that Mr. Yuk we began to really promote it as a poison center awareness tool, as well as a poison prevention tool. Because yes, it was inconceivable that people were going to put a Mr. Yuk sticker on everything that was hazardous in their home. You needed to keep the poison out of the reach of the child, rather than the Mr. Yuk sticker on the bottle as the deterrent and leaving it under the sink. So we taught those strategies, but we really focused on then creating tremendous awareness of the Poison Center itself. With the national 800 number, we had our own local numbers and so on, but then we went to the 800-222-1222 number and basically blanketed as much as we could of our service area in Western Pennsylvania with stickers and pamphlets and everything to create awareness of poison prevention and of the Poison Center itself.
Mm-hmm. So what did you see as a response from the community when you started utilizing Mr. Yuk in that fashion?
Well, our call volume skyrocketed.
Okay.
You could see with every, and that was the desired goal.
Right.
with every intervention or in every new strategy that we implemented, you could see increments in the call volume. And that was very rewarding because we knew that we were being effective. And then we would do, we highlighted some areas within the city where we did just a focused campaign. And then we monitored those telephone numbers. That was before there were a lot of cell phones. We monitored telephone numbers and zip codes because we always got a zip code. But the zip code was the most important. And that zip code would tell us how effective we were in getting into those areas. So we could say, okay, we just did this, let's say for McKeesport, we did this huge influx of education, and you could see your call volume go up every time you did something like that. So we used the data to help direct our efforts within Western Pennsylvania.
So after 50 years, how is Mr. Yuk still relevant today?
Well, it's just amazing. I live in northern Wisconsin and still a lot of my friends know me as Mr. Yuk. And when I go to national meetings, hey, Mr. Yuk, how are you? So I think there's a certain amount of carryover. People are really aware of Mr. Yuk. I think there has been perhaps a little bit less emphasis on Mr. Yuk nationally than say there used to be. But still, especially, I don't know about young children as much now, but I know people that are young adults and to elderly people still own a Mr. Yuk, and they can hum the jingle. It's just fun how Yuk evolved, and he's become, an icon.
What is your fondest memory of your time at the Pittsburgh Poison Center?
My fond memories would be all the staff members that we had over the years, and back when the whole COVID thing started, we had several text calls. I said, enough of this texting. Why don't we all Zoom? And so we had Zoom calls, and it was just fun to see so many people and talk. So we had just the staff of the foundation of the Poison Center, and without the Poison Center staff, I don't care who's director, who's doing anything else, the staff is the foundation of the Poison Center, and they're the ones that save lives and calm people down.
I thank you so much for your time.
And thanks for the opportunity, and happy birthday, Mr. Yuk and Pittsburgh Poison Center.